Hi, and welcome to the examination of blood parasite training video. Let's start with a specimen, which should be ordered and collected as stat. Parasites should not be in your blood, so it's critical that this patient is treated immediately. For the specimen, we will require 2 EDTA tubes of blood, each with 5 mLs. We can perform this procedure with less, but if the patient is positive, you will need the extra blood for sendouts. If you are unable to process the specimen immediately, we should refrigerate it. And that's because even in the tube, the morphology of the parasite will continue to change. So we have our sample, and the first part of the procedure is to perform a wet prep. We will place a drop of blood on a clean slide and place a cover slip on top. We will try to avoid bubbles and examine under low power for large parasite forms or motility. Here I've provided you a video from YouTube of a positive wet prep. The second part of the procedure is slide preparation. Here you will make a thick film and thin film smear. You can clean the slide with an alcohol prep. Allow it to dry. For the thick film, you'll dispense blood using a 10 microliter pipette. You can use a pipette tip to spread the blood out to the size of a dime. You should be able to see print through the blood. If you cannot, you've made it too thick and it will take too long to dry. You need to start over. Once you can see print through the blood, allow it to dry. Then place your slide into buffer, which will lyse the red blood cells and allow you to see parasite forms. After that, make your thin film. You'll clean the slide as before, and then make a smear similar to those used for white blood cell differentials, like pull-aparts, and then allow it to dry. Do not heat your slides. If you do, you can destroy the parasite forms. Now, a big key part to your slide preparation is making sure that your pH for your buffer is not too alkaline and not too acidic. As you can see with this chart, if it's too acidic, you will lose some of your morphology. But if it's too alkaline, you will lose some of your very key morphology too. We want to hit that 7.2, 7.3 area. Now we have our slide and it's time to examine. Take a note and notice that with the thick film, you don't see any red blood cells because they're lysed. With a thin film, you can still see them. We will start our examination by looking under low power and going around the edges of our smears. And the reason behind this is where you will find many of the filaria. And it's a cap requirement to examine 300 fields for each slide. If you do happen to see parasites, this is when you'll start your calculation for your percentage. And we want to make sure our calculations are accurate because it will affect treatment. Now the calculation is only infected red blood cells, so we don't want to calculate gametocytes, which happen to be external to the red blood cells, as you can see. The gametocytes for malaria are shown below. The first blood parasite we will discuss is malaria. And the main Plasmodium species that we're concerned with is falciparum. And the reason behind this is falciparum is the most dangerous. While the other ones can cause illness, falciparum can cause death. It reproduces at such a rate that it clogs small blood vessels, and it can occur in the brain and central nervous system. It is very critical that we rule this out. So please note falciparum's delicate rings. Note that it can have multiple rings in one red blood cell, where the others do not. If you see the trophozoite, schizoid, and segmentar parts of malaria, it's not falciparum. As you can see with the box that says sequestered, those parts happen for falciparum outside of the bloodstream, so you won't see them. Also note the unusual shape of the gametocyte for falciparum, which is more of a banana shape. You will also note in the procedure a couple of key terms that are exclusive to Plasmodium, such as Schoeffner's dots. In the red blood cell that has just appeared on your screen, you can see these frecklings on that infected red blood cell. Those are Schoeffner's dots. Those are exclusive to Vivax and Ovale. Falciparum does not have them. He has his own type of dots, called Moyer's dots, which we will see in the next slide. Notice the dots on these images of falciparum. They're a lot less than the Schoeffner's dots. These Moyer dots are very indicative of falciparum. And if you notice this cell right here, there's actually a cleft too from those dots. And that is another thing that's indicative of falciparum. Now this procedure is not just malaria, it's also all the blood parasites. So we will look for ehrlichiosis, which is an organism that affects monocytes. We'll look for trypanosoma, which is a flagellate, and babesia. We will also look for spirochetes, toxoplasmosis, and filaria. With the filaria, be careful that you're not fooled with fibers. Please note the tails. As you can see in these tails, they're enveloped and there's a little beading to it. Fibers tend not to have that beading that is indicative of filaria.